Palliative versus end-of-life care. Understanding the differences. Palliative care and end-of-life care are terms often used interchangeably. However, they represent distinct approaches to managing serious illnesses. Understanding the differences between them is crucial for patients, families, and caregivers. Palliative care focuses on providing relief from the symptoms and stress of a serious illness. It aims to improve the quality of life for both the patient and their family. This care can be offered at any stage of a serious illness. Palliative care is offered alongside curative treatments. It doesn't replace medical treatments aimed at curing the illness. Instead, it complements them by addressing the side effects and emotional challenges that can arise. The primary goal of palliative care is to improve the overall quality of life. This involves managing pain, reducing suffering, and enhancing well-being. It allows patients to live as fully as possible, even while facing a serious illness. Palliative care takes a holistic approach. It addresses the physical, emotional, social, and spiritual needs of the patient and their family. This comprehensive approach ensures that all aspects of well-being are considered. Physical symptoms like pain, nausea, fatigue, and shortness of breath are addressed. Effective symptom management is a cornerstone of palliative care. It helps patients feel more comfortable and in control. Palliative care teams typically include doctors, nurses, social workers, and chaplains. These professionals work together to provide comprehensive support. Their expertise ensures that patients receive well-rounded care. These teams help patients understand their illness and treatment options. They provide clear and accurate information. This empowers patients to make informed decisions about their care. Palliative care also helps patients navigate the complex healthcare system. They can assist with insurance issues, referrals, and coordinating care between different providers. This support reduces stress and burden on patients and families. The focus of palliative care is on living as fully as possible. Even while facing a serious illness, patients can maintain their independence, pursue their interests, and spend quality time with loved ones. Palliative care supports this. Now let's talk about end-of-life care. End-of-life care is specifically designed for individuals nearing the end of their lives. It is a subset of palliative care. It is implemented when curative treatments are no longer effective or desired. At this stage, the focus shifts to comfort and dignity. The goal is to provide the best possible quality of life during the final stages of life. This involves managing symptoms and providing emotional support. The primary goal of end-of-life care is to provide comfort, manage symptoms, and support the patient and their loved ones. This ensures a peaceful and dignified end-of-life experience. It also provides support for grieving families. End-of-life care often involves hospice care. Hospice provides medical, emotional, and spiritual support to patients and their families. It focuses on relieving pain and suffering. Hospice care can be provided in the patient's home or in a dedicated hospice facility. The setting is chosen based on the patient's preferences and needs. The goal is to create a comfortable and supportive environment. Pain management is a key component of end-of-life care. Medications and other therapies are used to control pain and discomfort. This allows patients to remain as comfortable and alert as possible. Symptom control is also emphasized. This includes managing symptoms such as nausea, shortness of breath, and anxiety. A proactive approach to symptom management improves the patient's quality of life. Emotional support is crucial during this time. Counselors, social workers, and chaplains provide emotional and spiritual support to patients and their families. This helps them cope with the emotional challenges of end-of-life. End-of-life care ensures the patient's comfort and dignity during their final days. This includes providing personal care, respecting their wishes, and creating a peaceful environment. It honors the patient's life and values. Bereavement support is provided for the family after the patient's death. This support helps them cope with their grief and loss. It can include counseling, support groups, and other resources. The key difference between palliative care and end-of-life care lies in the timing and scope. Palliative care can be initiated at any point during a serious illness. End-of-life care is specifically for those nearing the end of their lives. Palliative care offers a broader range of support. This includes support alongside curative treatments. End-of-life care focuses solely on comfort and support when curative options are no longer viable. Both palliative care and end-of-life care aim to improve the quality of life. However, they do so at different stages of illness and with different goals. Understanding these differences is essential for making informed decisions. Choosing the right approach depends on individual needs, preferences, and the stage of the illness. There is no one-size-fits-all solution. The best approach is tailored to the specific circumstances of each patient and family. Open communication with healthcare providers is essential. Discuss your concerns, ask questions, and share your preferences. This will help determine the most appropriate care plan for you or your loved one.